When wrist pain and stiffness from arthritis can no longer be managed with conservative treatments, wrist surgery may be an option. Dr. Nikola Babovic, a hand and upper extremity surgeon at Reno Orthopedic Center in Reno, Nevada, outlines the range of wrist conditions.
When it comes to wrist surgery, there are a lot of different types of problems that can develop in the wrist without an injury. One of the most common is just regular osteoarthritis, which is wear and tear of the wrist from normal use, wearing down of the cartilage, and normal human aging. Now, sometimes it's just a little bit of wear and tear everywhere. Sometimes an individual has had a specific injury in the wrist in the past, maybe a ligament tear, maybe a broken bone that wasn't noticed. And these types of injuries can lead to very specific patterns of arthritis.
Dr. Babovic emphasizes that a good evaluation of a patient leads to the proper treatments.
The importance of all of this is that we evaluate the patient appropriately and determine where their pain is coming from, because x-rays don't always correlate to what the patient is experiencing. So when a patient presents to me with wrist arthritis, the first step in my path of thinking is to determine what is the cause and then what is the best treatment. Sometimes conservative treatments are appropriate, such as splinting, bracing, over-the-counter anti-inflammatories, and cortisone injections. When those things don't work, then we consider surgical options.
Medications can be useful to decrease the pain of wrist arthritis.
So there are several types of injections that we utilize in the orthopedic field. The most common is cortisone injection. So cortisone is a very potent anti-inflammatory. So arthritis, for example, hurts for several reasons. It hurts because of the mechanical grinding, loss of cartilage, and bone-on-bone arthritis, but it also hurts because the joint gets inflamed, and so cortisone can help decrease the inflammation and make patients feel better.
Dr. Babovic describes the variety of wrist surgeries offered at Reno Orthopedic Center.
One of the most commonly used treatments for arthritis is a joint fusion, where we remove the cartilage and make the bones heal into one bone. And this is a great option for eliminating pain, but the major downside is that it eliminates motion, which can have a big impact on function. Other more modern options that we have available to us include joint replacements, and there's a wide variety of different types of joint replacements. We can do partial joint replacements, complete joint replacements, and we now even have biological materials that we use for joint replacements, which have distinct advantages. Partial wrist replacements allow us to perform a procedure where we can eliminate pain for a patient while still preserving motion, which is a huge advantage over a fusion where we would normally eliminate all motion. So it allows us to eliminate the patient's pain but preserve motion, which improves function.
Can wrist arthritis be prevented?
Certain types of arthritis are preventable. For example, autoimmune or inflammatory arthritis, such as rheumatoid arthritis, lupus, psoriasis, gout, or infections. But regular osteoarthritis, which is from wear and tear, with today's technology is not preventable.
Orthopedic surgeries have become very successful.
Studies have shown that wrist replacements and partial wrist replacements and thumb replacements are actually as successful as hip and knee replacements today. Hip replacement surgery is considered one of the most successful operations in all of the history of medicine, and studies now are showing that the length of time that patients can gain relief from a wrist replacement or a thumb replacement is equal to that.